Hello, I'm Alan Getgood. I'm Chief of Surgery here at Aspetar and focus on sports knee injuries, particularly ACL reconstruction and patella instability and joint restoration type surgery. One aspect of my practice that I'm particularly well known for is complex knee surgery. People often ask, well, what does complex knee surgery mean? How is that different from maybe routine surgery such as ACL reconstruction that we do on a more regular basis? Complex knee surgery really revolves around cases that maybe we don't do quite as often, such as revision ACL reconstruction, such as dealing with higher energy injuries, such as knee dislocations. Patients that have had surgeries in the past that maybe are continuing to be suffering from whether it's pain or further instability and are struggling to get back to their routine sports activities or even just trying to get back to work. That may often revolve around problems associated with their alignment, so how they stand, how they walk, but also the function within the knee in terms of their meniscus, their cartilage. And so complex surgery often means that we're doing more than one procedure at any one time, really trying to restore normal function to the joint. One of the biggest issues that we have with athletes coming to Aspetar is, they may have had previous ACL surgery. That's the most common injury that we find in our athletic population, particularly footballers. And unfortunately, whilst ACL surgery is good, and we do get the majority of our athletes back to their pre-injury level, unfortunately, they are at high risk of re-injury. When that happens, we may be in a position of having to do a revision ACL reconstruction, in which case then we will look at the number of risk factors or the number of reasons why they've had a failure in the first place. And then with the surgery, we try and address some of those risk factors. So some of the things that we're really focusing on here at Aspetar is an individualized assessment of the problems that can occur and the solutions that we may be able to address. In the Middle East, one of the biggest issues that we find is sometimes the alignment of the bone, what we call the morphology of the bone, the shape of the bone. The shape of the bone actually puts athletes at a higher risk of having another ACL injury after an ACL reconstruction. And one of those specific things is what we call posterior tibial slope. It's essentially the shape of the tibial slope of the shin bone. And that has a major impact on putting increased forces on our graft, what we use to replace the ACL, and puts the ACL at increased risk of re-injury. And so what we do is we change the shape of the bone by doing what's called a realignment osteotomy, which is just essentially cutting the bone and changing its position. The real technical jargon is an anterior closing wedge proximal tibial osteotomy. That surgery, whilst it's being performed all around the world, we're particularly known for doing it here in the Middle East, and it's an area of expertise. I've published on this area over the course of the last number of years, and we continue to evolve our techniques to really try and improve our outcomes. At Aspetar Precision Surgery, we're really looking towards building more precision instruments, so using personalized instrumentation where we can get a more accurate, more reproducible correction, ultimately trying to improve the outcomes for athletes and get them back playing the sport that they love. One of the biggest advantages, or at least improvements that we find, particularly when we focus on ACL surgery, has been the individualized nature of our preoperative, but also intraoperative assessments, and also of our treatment post-operatively. When we look at our preoperative assessment, we can do an individualized risk assessment. What are their needs? If it's an athlete trying to get back to playing football, for example, they're much more likely to have surgery. If we have maybe a non-athlete, we may be less likely to do surgery and really focus on our rehab outcomes. For our athletic population, well, whilst we may be heading down a surgical route, what we really want to do is prioritize or optimize their conditioning prior to going to surgery, and so our rehab specialists will get involved, our nutritionists will get involved. So we have multiple areas, a multidisciplinary team where we can make our assessment of our patients both preoperatively as well as postoperatively. Our surgical decision making, we use a lot of our imaging protocols where we can take more measurements, more assessments, so that again we can optimize the surgical techniques that we use to try and improve our outcomes. Post-operatively, then our rehab specialists really come to the fore, and that's where we have such huge expertise here at Aspetar, where we can take some of the aspects that we've really tried to improve on in our surgical side of things, but really take it to the next level to get our athletes back to the pre-injury levels of sport. So one of the biggest things that we can do for our athletes are looking at prevention programs. Unfortunately, when an athlete comes to me, maybe not so much from the first injury, but if it's second, third injuries, where we're getting into that sort of complex nature, those are really challenging areas, and the outcomes, whilst again they are good, it can be very difficult to get people back to doing the things they absolutely want to do. The best solution is to try and prevent the injury in the first place. And there's lots and lots of research that have focused on ACL prevention, injury prevention, trying to reduce the injuries in the first place. The FIFA 11 Plus is a great example. Simple exercises that athletes can do prior to their training sessions, prior to their games, to really try and reduce the risk of re-injury. And for sure, that has been shown in multiple studies to be very effective. In terms of when we get into the complex surgery side of things, well, then it's about goal setting, understanding what our goals are in terms of actually what patients want to do. In our athletic population, it's very challenging. The more complex nature of the surgery, maybe the second or third injury, or the second or third surgery, or even more than that, then it starts to become maybe more difficult to suggest you're going to go back to be playing at the level of play or the level of participation as before. So some of the aspects where we have to discuss is the type of surgery that we are doing, is the goal to get you back playing the way you were, or is it maybe modifying your activity level, trying to find new sports? The goal always is to keep people as fit and healthy as possible, continuing to having exercise as part of their normal day-to-day life, because we know the benefits of exercise in terms of reducing overall injury risk, but also for generalized health. One of the real unique parts of Aspetar is the multidisciplinary nature of how we address certain injuries. And if we take anterior cruciate ligament injury as an example, because it's one of our most common types of surgeries that we do, or at least we see lots of patients with ACL injuries, then this really is a one-stop shop for athletes when it comes to ACL injury. We have prevention programs. We have areas of optimizing conditioning prior to surgery. We have a rehabilitation post-surgery, but we also have areas where we look at sports nutrition. We have sports psychologists. Everything that we can provide to an athlete to ultimately help them get through a surgical procedure, or indeed if they don't have surgery, go through their rehabilitation process, again to try and get them back to the level of play that they were before they had their injury. And that, I think, is very unique compared to many other parts of the world. We meet regularly as a multidisciplinary team with our physiotherapists to discuss problem cases, to discuss areas that we as surgeons may need to provide input, but equally get input from our physiotherapists, again to make sure that every area of the journey, every part of that journey is optimized. And we use data. Data is collected on a regular basis. We have our assessment lab. And so we can take that data and we can then really change what is going on. We can alter the course of management to eventually to try and get people back to that level of play as quickly as we can and as safely as we can.